Welcome back to the Best PT Podcast. This is episode 7.2, Gastrointestinal Pathology. Starting with the esophagus, we have gastroesophageal reflux disease, or GERD. The cause is an incompetent lower esophageal sphincter. Signs and symptoms include heartburn, regurgitation, belching, angina, and cancer. The main treatment here is pharmaceuticals. In the stomach, we have gastritis, which is an inflammation of the gastric mucosa. Signs and symptoms are similar to GERD but with higher intensity. The treatment here is pharmaceuticals. Two different subtypes of gastritis. Erosive gastritis or acute gastritis is caused by bleeding from gastric mucosa due to stress, insect abuse, alcohol abuse, viruses, or trauma. Signs and symptoms include dyspepsia or indigestion, nausea, vomiting, and hematemesis or vomiting blood. That's never good. Treatment: remove the stimulus causing the gastric mucosa bleeding, the NSAIDs, the alcohol, or the virus, and then treat with pharmaceuticals. Surgery may be indicated. And then non-erosive gastritis or chronic type B gastritis. The cause here is Helicobacter pylori or H. pylori infection. Signs and symptoms are usually asymptomatic. The treatment involves aggressive treatment of H. pylori bacteria with pharmaceuticals because H. pylori is a carcinogen. And then finally, peptic ulcer disease is the erosion of gastric mucosa, usually due to chronic NSAID abuse or, again, H. pylori. Signs and symptoms include epigastric pain, heartburn, nausea, vomiting, bloody stools, and pain that is relieved by eating. Treatment involves pharmaceuticals, and again, surgery may be indicated. In the intestines, we have Malabsorption Syndrome, which is reduced intestinal absorption and adequate nutrition caused by other diseases such as celiac disease, cystic fibrosis, AIDS, Crohn's disease, and Addison's disease. Signs and symptoms include weight loss, chronic diarrhea, anemia, fatigue, abdominal cramps and bloating, indigestion, bone pain, and severe gas. Treatment involves avoiding the underlying cause, probiotics, antibiotics, and nutritional support. Irritable Syndrome is caused by hypersensitization of the colon or large intestine. Signs and symptoms include abdominal pain and bloating, nausea, vomiting, diarrhea, and anorexia. Treatment is usually a diagnosis of exclusion from other GI pathologies and treatment with pharmaceuticals. Diverticulitis is inflammation or infection of diverticula, which are pouches of the colon. Signs and symptoms include abdominal pain, tenderness at the left lower abdomen, cramping, constipation, nausea, fever, chills, and vomiting. Treatment involves diet modification, controlling underlying infections, lowering colon pressure by increasing fiber intake, possibly a nasogastric tube, which will be required for gastric rest. In the gallbladder, we have cholecystitis or cholelithiasis is caused by acute or chronic gallbladder inflammation. Signs and symptoms include right upper quadrant pain and rebound tenderness. Treatment is a low-fat diet and possibly a laparoscopic cholecystectomy to remove the gallbladder or stones. In the liver, we have hepatitis. Hepatitis A. The cause is fecal-oral route or contact with an infected person. Signs and symptoms are flu-like, and treatment recovery usually occurs naturally in 6 to 10 weeks. Hepatitis B is caused by sharing needles, sex with an infected person, or maternal fetal exposure. Signs and symptoms are flu-like with a fever, fatigue, anorexia, headache, jaundice, dark urine, light stool, and enlarged spleen or liver. Treatment involves hepatitis B immunoglobulins within 24 hours of diagnosis, followed by a vaccine series at 1 and 6 months. If this does not occur, it is usually a chronic lifetime illness. Hepatitis C, again, shared with the sharing of needles, sex with an infected person, or maternal fetal exposure. Signs and symptoms can cause Hashimoto's thyroiditis, diabetes, and ulcerations of the cornea. Treatment is with a drug called interferon alpha 2B. And finally, liver cirrhosis is caused when healthy liver tissue is replaced by scar tissue that blocks blood flow through the liver, usually due to alcohol abuse, hepatitis C, or non-alcoholic fatty liver disease. Signs and symptoms include fatigue, decreased appetite, nausea, weakness, abdominal pain, weight loss, ascites or water accumulation in the abdomen, jaundice, gallstones, and encephalopathy. Treatment Cirrhosis is usually incurable. Medications only alleviate symptoms and slow progress. A liver transplant may be necessary. That's it for episode 7.2, Gastrointestinal Pathology. The next episode, 7.3, we'll talk about gastrointestinal pharmacology. As always, the outline will be in the show notes. Thanks for joining me.